as the platelets are activated through the von Willebrand factor and collagen exposure, they will start aggregating at the side of injury. They are coming towards the injury, and when they are activated, they change their shape from the typical rounded disc to the somewhat rectangular having spiky protrusion, so they can aggregate best at the site of injury. Now there is an injury, von Willebrand factor and collagen gets exposed, and the platelets will bind to these two factors, and they will start aggregating there. Now these platelets will help recruit other platelets as well. They will release substances like ADP, serotonin, and thromboxane. These three things will help other platelets to come at the site of injury, and will start aggregating there. So here are a lot of platelets at the site of injury due to substances released by platelets. So you can see here is a primary platelet plug. This is called primary platelet plug. Whenever there is platelet aggregation at the site of injury, we call it as a primary platelet plug, and the secondary platelet plug occurs when there will be clotting factors, and they will activate fibrinogen, and fibrin will aggregate here. So our second step, which was the platelet plug formation. So here we have studied the primary platelet plug formation. Now the secondary platelet plug will form when fibrin will come at the site of injury. Now what is fibrin? Fibrin is a protein that is present in our circulation. Suppose this is fibrin. It is present like this. When it is this is fibrinogen. Fibrinogen is an inactive form. When it will active, it is called as fibrin, and activated form is like this. All the fibrinogens particles will come together, and they will form chain like this. Okay, so this is fibrin. These are the fibrinogen. Now we will study how this happens. When there is an injury, suppose here is an injury. Now tissue factor get exposed at the site of injury, will set in motion a cascade of clotting proteins. These clotting proteins are basically formed by our liver, and when a tissue factor is exposed, it activates our factor 7. And when there is factor 7 activation, there will be formation of 10 to 10A, active 10A factor. Now this is the factor. Basically coagulation pathway are of two types, intrinsic and extrinsic, but here we are not going into the details of coagulation pathways. So tissue factor will activate the factor 7, which will through some steps through activation of other clotting factors will activate factor 10 into 10A, and now this 10A will convert prothrombin to thrombin. Thrombin is factor 2 clotting factor. And now this activated thrombin will convert fibrinogen into fibrin, as I have explained. This is the fibrinogen and this is fibrin. So this fibrin will reach at the site of injury, and it will form a meshwork here. See now, this is the clot stabilization. Clot has stable due to fibrinogen, due to fibrin meshwork here. So this was the third step that helps in formation of platelet plug, and when there is fibrin accumulation inside our platelets at the site of injury, this is called a secondary platelet plug. So these are basically the three steps basically 3 steps out of 5 of hemostasis. Vascular spasm, we have studied platelet plug formation. Then there is coagulation, which will set in motion a cascade of coagulation pathway, which can be of two types, intrinsic and extrinsic, which will help formation of thrombin, and thrombin will convert fibrinogen into fibrin, and fibrin will accumulate here, and there will be the secondary platelet plug formation. Now the fourth step is clot retraction and repair. Now we will see how clot retraction occurs. So here I have also written the 3 steps how clot retraction occurs. First one is platelet contraction. We know these platelets are accumulated here. Consider these platelets have 2 arms, one arm here and one arm here, and they are pulling this endothelium close, this whole structure close together, so this will help the clot retraction. So first of all, there is platelet contraction, platelet will contract, and so there will be repair. Second thing is platelet derived growth factor. Now what is this factor, and platelet derived clot factor, and what it helps? It helps connective tissue formation. Okay, platelet derived growth factor means these platelets will release some growth factors which will help smooth muscles plus subendothelium to repair. And third thing is vascular endothelial growth factor. Now what vascular endothelial growth factor? Name indicates that this will help repair regeneration of endothelium. So this whole step is called clot retraction, in which there is platelet contraction, and then there is release of 2 types of growth factors. One is platelets derived growth factor, which will help subendothelium and smooth muscles to repair, and then there is vascular endothelial growth factor, which will help our endothelium to regenerate and repair. So these are the we have studied 4 steps of hemostasis up till now. And 5th step is fibrinolysis. 5th step is fibrinolysis. Fibrinolysis, as the name indicates, that here will be this meshwork of fibrin will break down into pieces, so that there is control, there is a check over clot formation. How this fibrinolysis occurs? Our endothelium, and it has tissue plasminogen activator. It has normally tissue plasminogen activator. What is the function of plasminogen activator? It will convert plasminogen to plasmin. And now what is the function of plasmin? Plasmin will go and degrade fibrinogen into fibrin. So it will come here and it will start degrading this fibrin. So fibrinolysis, how fibrinolysis occur? Our endothelial cells has tissue plasminogen activator, which will convert the plasminogen into its active form plasmin, and then plasmin will cause the lysis of fibrinogen. So these are the five steps of hemostasis. And when there is lysis of fibrinogen, there is formation of 2 things. So these were the 5 steps of hemostasis. First one was vascular spasm. We studied how vascular spasm occurred. Second one was platelet plug formation. Third one was coagulation. Then clot retraction. Fifth one was fibrinolysis. This is how hemostasis occurs in our body whenever there is some injury in our body. Thank you for watching. Bye bye.